Right now, local businesses, though, scrambling to make changes for the new mask mandate.
We continue our live team coverage this morning with Dayton 24/7 Now's Alex King. She breaks down the challenges many are now facing. Alex.
Yeah, we're here outside of Boston Stoker Coffee House and Juice Bar, one of the many businesses waking up to the mask mandate today. Employees told me every day is different here. Some days are busy with customers, other days are too slow. City commissioners saying they hope this decision will help local businesses. I spoke with the manager here at Boston Stoker, and she says their employees have been masked up for as long as the CDC has recommended. Anna McCormick says this store has no problem complying with the mask mandate.
Everyone's got to do what they can to keep businesses open now. It's really important to stay open and be open in the dining room. So I would say it's a great idea to mask when you can, to be as safe as you can during the season, but it's just the way it's got to be.
However, she says they won't force customers to wear one. McCormick says they will highly recommend it, but store employees don't want any friction between its customers. Now, Dayton police will enforce it, and they can fine people up to $85 if they do not comply with the mask mandate. Stay with us, because we're going to hear more from McCormick about how their business has specifically been doing throughout the pandemic. Live in downtown Dayton, Alex King, Dayton 24/7 Now News.
Right now, allergy, cold, and flu season heating up here in the Miami Valley, creating some confusion when it comes to deciding if you need to be tested for COVID-19.
Dayton 24/7 Now's Alex King took these concerns to the health experts, joins us live this morning and breaks down what you need to know.
Yeah, good morning, you guys. Right now, we're here at the former Montgomery County Fairgrounds. It's one of the sites where Premier Health provides drive-through COVID testing. Healthcare providers tell me they are seeing a rise in COVID cases among two categories of the population: younger patients and those who are unvaccinated. With the lack of staff in healthcare across the nation, there's more work and not enough people to do it. Now we're seeing people experience a cold, myself included, and we're heading into flu season. Dr. Joseph Allen, a regional medical director with Premier Health, says that healthcare workers are seeing a lot of that right now.
I think my biggest fear last year at this time was, oh my gosh, we're going to have flu hit and COVID. How do I tell the difference? What's going to happen? Luckily, we didn't have a real strong flu season, so that was wonderful. This year, I'm going through the same process of, oh my gosh, what are we going to do again?
Yeah, he says there's not a right or wrong time to get tested, but if you have a high degree of suspicion or you've been exposed and are showing symptoms, it's a good idea to get tested. Dr. Allen says it's always important to get immunized if you can. I asked him if hospitals are seeing a high number of cases of people who are fully vaccinated.
When you hear that breakthrough case kind of term thrown out there, that's it. I was immunized. Now I have, now I have COVID. I tested positive for COVID. That breakthrough cases, there's a lot of different definitions for that. If you define it basically as just, I had the immunization and now I'm testing positive, we are seeing quite a few of those. The difference is we're not seeing those folks on ventilators and in the ICU.
Yeah, and either way, he says that to make sure you get good information from your trusted healthcare providers. We're going to have more information about this on our website, Dayton247now.com. Stick with us, because we're going to talk more about some specific symptoms to look out for and how we can figure out the difference between allergies, cold, flu, and COVID. Live in Dayton, Alex King, Dayton 24/7 Now News.
Thanks. Tonight, the Ohio Department of Health pleading with Ohioans to get vaccinated. Cases continue to rise, as we mentioned. Hospitalizations are triple what they were last September.
Now this comes as public health warns the Delta variant is making its way into local nursing homes. Only on Dayton 24/7 Now, our Allison Walker speaks with top health officials and long-term care facilities about the risks. Allison.
Cases and hospitalizations across the state are reminiscent of last winter's surge that hit our elderly population the hardest. And now Delta variant breakthrough infections are putting vaccinated seniors at heightened risks.
The Delta variant is aggressively seeking out anyone who lacks immunity and is making many of them very sick.
The Ohio Department of Health reports just this week 13 seniors in Clark County tested positive for COVID-19. And 15 in Montgomery County. Public health believes these are likely breakthrough infections.
We thought we did have an end in sight, but then the Delta variant popped up and kind of changed that.
Melissa Puckett with Widow's Home of Dayton says while their facility has had no recent COVID-19 outbreaks, area facilities are on high alert, offering virtual visitation and requiring all in-person visitors to mask up and get tested.
The interactions with families has changed because they are trying to see their loved one or trying to find out information about their loved one more frequently, more often.
So I took these concerns to our state's health director, Dr. Bruce Vanderhoff. How widespread is the increase in breakthrough infections in nursing homes across Ohio? How severe are these infections, and is the state going to release updated visitation guidance since the booster shot timeline is uncertain?
While there have been some increase with the Delta wave, the cases are still extraordinarily rare. There's an important balance between the benefits that come from avoiding social isolation.
And Puckett encourages the community to step up and get vaccinated to protect our community's most vulnerable. She says if one positive COVID-19 case pops up in nursing home facilities, all family visitations will be put on hold, which will have devastating effects on residents' mental health. Reporting for Dayton 24/7 Now News, I'm Allison Walker.